Travel nursing can bring you to places you've never been before. Tell us your story.
Good morning. Good morning. It's Rita at the Travel Nurse Channel. Today is Tuesday the 8th. We're less than a week from Valentine's Day. I hope you have somebody's heart in your heart to embrace that Hallmark holiday. So I was gone last week. I had a little vacation, and it was really wonderful to swim in a salty ocean and have sunshine every day and be with friends. That was wonderful. However, I stayed somewhere that had many, over 200 steps to get in and out and down to the beach. So I had quite the workout, which was good because I could eat and drink and not gain weight. That was good. But my knees are killing me, folks. Ooh. All right. So, and I used to always take the stairs at work when I worked in bigger facilities that had multiple floors. If I was going on an errand or if I was going to eat or whatever, I'd always try to use the stairs. But when you have no choice, it becomes quite the drudge. Okay. So I thought I'd talk about some strategies. I hope we have enough light here. And from the perspective of the nurse and the travel nurse, the staff nurse, the nursing staff, right? They compose sometimes more travelers than staff persons nowadays. They develop a special team, and they have to manage with what's going on, which is a lot of shortages. And so it affects, I have an itchy nose. It's quite dry. It's quite dry here in Southern California. So I thought let's identify what's going on from the perspective of the nurse and what's going on from the perspective of the employer, and what kind of things are being developed to manage, and what you as a travel nurse or a staff nurse or any part of that team, what you can do. So that's what I thought I'd talk about. And this has affected healthcare workers in various environments for quite some time. So for example, on a personal level, if you're working and you have small children and they're sick, what's your backup plan, right? So maybe you have childcare, or maybe they're school age. But if they have a fever, God forbid they have COVID nowadays, you have to protect the community, and you have to do what's best for the childcare providers and for the schools and the preschools and the high schools and so forth. So there has to be a plan, a strategy for those situations. And if you're fortunate, and when my children were quite small, particularly the first two, who were born in the 80s, and then the last one was born in the 90s, if you're fortunate, you have a family member. If you're not fortunate, I don't know why I'm so itchy. I'm just itchy. I'm dry. There has to be a backup plan. So same thing in the hospital situation, in the nursing home situation, in the clinic, and so forth, and all the places where healthcare workers are employed. There has to be a plan, a strategy, and a backup plan, right? So for travelers, it's pretty tricky because sometimes in your contracts, there will be verbiage about calling off, and maybe you're allowed to call off 2 times, and then you have to have a doctor's note. And I mean, it happens. People do get sick, and COVID would put you out for even more time than that. So be looking in the contracts for language regarding COVID specifically, other than sick days, right? You have to address a sick day is a sick day. So if you stub your toe and you need stitches, you really stub your toe badly, you take care of it, you see a professional, and you have an idea of when you can get back to work. Nurses spend a lot of time on their feet, so their feet have to be in good shape. I'll give you one of my little tips that out of necessity I figured out doing so many 12-hour shifts over the years is I always brought a spare pair of socks and or a spare pair of shoes. And when I had a rest period, which wasn't often, it wasn't always a half-hour lunch, it was very often a 10 or 15-minute break. But when even that, you need a break, and maybe just take a couple of 10-minute breaks and just rejuvenate yourself however you can with food or drink or rest. But during that time, I would usually, if I were wearing cotton socks, I would put on support hose. If I were wearing support hose, I'd take them off and put on the cotton socks, or I would change shoes. And it just was a boost for me. I don't know if that would help you, but it might, so I throw it out there. Okay, so let's start with the employer and what the CDC recommends, the Center for Disease Control, what OSHA and the Joint Commission and so forth are looking for when they see a shortage at a facility, what the recommendations are. And I have some notes here. Let me see. From the perspective of the employer, the contingency capacity to mitigate staffing shortages. When staffing shortages is anticipated, the facilities and the employers, in collaboration with HR, human resources, and the occupational health services, should use strategies to prepare for this problem. And this problem has been around now for a couple of years with COVID, particularly. This time of the year, there's also other flus going on. My mom, who's a relatively healthy 92-year-old, post major stroke, she is paralyzed on her right side, has managed to not get COVID, while staff and other customers where she lives in an assisted living facility that is pretty large and has a skilled population. Their largest population are the assisted living persons like my mom, and then they have a memory care. So they're a pretty large facility. I think they're over 200 beds. And what they have to do is they have to cut down. They have to cut down on the activities, the procedures, and anything non-essential. In a bigger acute setting, they might have to cut down on surgeries. They did that at the beginning of COVID. A lot of areas of the hospital were completely shut down or partially shut down to support the patients with the staff that they did have available. So that is a big responsibility for a healthcare organization, for a facility, healthcare facility, and a concern if it goes on for too long, because they need revenue to keep things rolling. So, but that is absolutely what they have to do when they do not have enough staff. Another thing they need to do is address social factors to prevent the healthcare personnel from reporting to work when they're not well. So, so they have to, it's almost impossible, the social distancing. I see people kind of breaching that. Recently, I traveled to my vacation in Mexico. I took a plane for a couple of hours, so I was in an airport at both ends, and you know, taking a van or a cab or whatever to my destination. Just, you know, most of my eating was outdoors. Most of my living situation was in a bubble with people I knew that were vaccinated and healthy, but it wasn't always appropriate. The social distancing was not always appropriate in my travel, particularly in the airports and in the transportation. And again, I think in a healthcare setting, there's limited, I mean, you have to be close to your patients. You can certainly use all the protective equipment, but with your coworkers, it's very, very difficult to maintain that social distancing. So if you are a traveler and you are in a situation where you feel somebody's coughing, whatever, utilize your chain of command. Go to the person in charge and say, I'm really concerned. Every time I go to the nursing station, there's one or two persons there that are continually coughing or taking off their mask or grouping closer than 3 to 6 feet together. If those are concerns, you need to consider reporting that. I encourage you to report that, because a person in charge, a manager in charge, can't fix a problem that they're not aware of. So you have to speak up, and you don't have to be rude and you don't have to be angry. You just have to report. It's necessary. So yeah, so this attempt to address the social distancing factor is a strategy that the employer, the healthcare facility, really has to address and have a strategy and a plan for that. So that is something to be aware of. They have to have these waivers. For example, if you have contracted COVID and you need to know what the expectation is. You may or may not have other healthcare issues. You may or may not have respiratory problems. You may or may not have diabetes or hypertension. You may be generally healthy and just happen to get the COVID virus. And hopefully it's one of these newer strains, more recent strains in 2022 that are not going to be as debilitating as the original COVID-19 was. But you need to talk to HR, talk to your supervisors, and know what the expectation is and when to get tested again and so forth. I'll give you an example of a friend of mine who is a nurse and who works in hospice, home care hospice, and God bless her. She had COVID when it originally came out, and then she contracted it more recently. She was traveling. So somehow, and that transit, which I think is that transit, whether it be by bus, train, plane, taxi, whatever, is a big factor. And no matter people wearing masks, the masks are only so effective. The shields are helpful, the N95s are helpful, but that's not what most people are using. Generally, when I go out, I have cloth masks. I have an N95 in my car if I feel I need it, like if I'm going to my mom's facility and they've reported a lot of outbreaks, I might wear the N95 just to go into the lobby and check in with my mom. Usually she will come out and I take her wherever we're going, and we switch over to the cloth masks for comfort and because we're in the car, and we keep our social distancing while we're out. Okay, so the healthcare provider, facility, hospital, nursing home, whatever, they have to have a plan and a strategy for when the worker, if you get sick, if you stub your toe, if you have a minor setback, maybe an upset stomach one day, your plan is to get right back to work. So you call in, whoever you call in, your manager, your HR, however your contract directs you to do, you say, I'm out. It seems to be a stomach thing. I anticipate being back tomorrow or tomorrow night, whatever your shift is. And excuse me, they say, great, thanks for calling. Thanks for giving us 4 hours notice. 8 hours notice, whatever. If you're planning on working in the morning, you may have woke up with a upset stomach during the night, so you can give them lots of notice. Or you may have woken up with just a couple of hours before reporting to work, so you only gave them 2.5 hours. You do the best you can. You did not know when you went to sleep at night you were ill, but you woke up ill. And it seems to be something that's going to be self-limiting and you're going to get well soon. If they say to you, do you have fever? Have you been with anybody with COVID and so forth? Whatever their strategy and procedure is for screening you, they will direct you when you come back to work to do ABC, which may include getting a COVID test, which may include reporting to their in-house employee health, or going to somewhere prior to returning to work. So find out what all the specifics are, and if it's not COVID, great. If it is COVID, what do they recommend, and is there a waiver? Because a lot of people, they're recommending 1 or 2 weeks of isolation with COVID. So I was starting to talk about my friend who is a hospice worker. So obviously her clientele are very compromised. They're end-of-life patients and very distressed families that are probably in a weakened state. And so she has COVID, and they told, I think her isolation period was 7 or 10 days and retesting. And when she retested, she was positive. So then she was directed to the physician, and the physician gave her the waiver that she was asymptomatic, she was COVID-free, and would, continue to test on whatever basis, in 2 more days or in 1 more week, but that she was able to return to work. So find out that. That's important, and it's going to vary per employer. So let's see. Okay. Okay, so let's talk about it from the employee perspective. Because there is this terrible shortage, what can you do? Well, as a traveler, you're the cavalry. You're going to come in and relieve people that have a need. They have a shortage, and they needed you before COVID, and they need you even more. I actually think that I will broadcast soon about some of the statistics, what the percentages are of, let me get a drink here. So I don't start coughing on you, because I am just really kind of dry. I think maybe I'm a little sensitive to it because I had a week in a place where it had fair in the 70s of humidity. And here in Southern California, we have super low humidity. So I'm readjusting. So where was I? Oh, the employee perspective. So if you're a staff employee, you may postpone your vacation time or your PTO or whatever plans you may have had out of loyalty to a employer who is very short-staffed. So you might, if you're on staff, speak to the person in charge or HR, whoever you talk to about these things, and say, I'm okay. I'm doing well. My family's doing well. I was planning on taking this week off, or these 2 weeks off, or these 3 weeks off in February, but I can delay that if it would be helpful to you. And excuse me, here I am talking about health, and I'm itchy and I'm sneezing. Excuse me. One more. Okay. I know it's not too dusty in here because we got cleaned. What is today? Tuesday? We got cleaned on Thursday, so it's not too dusty, and the dogs don't really hang out in here too much. I apologize. So as an employee, particularly a staff employee, you can offer that. That would help the staffing shortage temporarily, but gives your employer time to maybe look into another traveler or two to help the staffing situation. So if that's appropriate and you can do that, great. If you're a traveler and you had planned on working 12-hour shifts and your assignment is spread out pretty comfortably for you, say 2 days on, 2 days off, 2 days on, 1 day off, 2 days on, and so forth. If you have a schedule like that with some gaps in it, and you see that the facility is scrambling, and you want to be helpful to the team, you can go to HR or your manager. And I would also probably make my first call to my employer. In other words, you're working as a traveler out of state in a particular facility, whether it's a nursing home, an acute facility, an emergency room, whatever, clinics and so forth, and you see that they're short-staffed. Maybe it's an outpatient oncology clinic, maybe it's a urgent care, whatever. You see that your schedule, because you do the 10-hour shifts or the 12-hour shifts, that you have some opportunities. You have some like 3-day strips off, or 4, maybe even 5. And you think, I was thinking I was going to go hiking or meet with my sister and take a few days at the spa, whatever. Maybe you think, you know what, they're really needy here and I want to be a strong team member. I will offer my services, at least 2 of my 3 days off, or 2 of my 5 days off, or whatever, and see if I can be helpful to them. But before doing that, you might want to check in with your employer, your travel company, and make sure they think it's appropriate and how that'll affect the contract and so forth. So just double check, have your strategy, have your plan ready, and wonderful to be helpful to the team you're working with, but also to be cognizant of what your company might need. You know what? I'm not sure I opened up the comment line, so I see a number 1 there. Oh dear. Oh yes. Hi, Sandy. It's me. Oh, blast from the past. Yep. This is my nursing channel that I tune into once a week. If you want to see other episodes, I've been doing this for a couple years now. You can find the archives in either Facebook or YouTube. So yeah, it's me. Actually, if you go back in the archives, it was before I stopped dyeing my hair. It was a dark brown, and it was all shades of brown, but none of that anymore, Sandy. It is what it is. So thanks for tuning in. Tell all your friends, particularly nurses that travel and healthcare workers that travel, that we are here. The Travel Nurse channel is a conduit for those that employ travelers and for those that travel. And the Travel Nurse generally travels for 13 weeks at a time, 90 days, and but there are other contracts that are longer, and they might double up and do a 6-month contract. And it's been going on for a while, but it is such a need right now with COVID and the shortages in staff. So we're talking about that, the strategies and plans that the employer has to have, meaning not so much the travel employer as the the healthcare facilities, the hospitals and nursing homes, the clinics, the doctor's offices, etc. They have to apply, they have to adjust to this shortage in their staffing schedules. And one of the things they have to do is they have to eliminate non-essential procedures and surgeries and that type of thing. They have to have policies and waivers for staff that are sick in a different way than, say, stubbing a toe or having a cold, where they might not need to see a healthcare provider during COVID. There might be stipulations where they do have to see a healthcare provider and maybe spend more time out of work than expected if there is a fear of having COVID. So there's all kinds of things, social distancing, and how is that applied in the healthcare setting, and then identifying. The provider has to identify solutions to get additional staff in place when the shortage becomes illegal, when it becomes a litigious matter, they have to meet certain criteria for the healthcare department, for the Center for Disease Control, for the Centers for Disease Control. The Centers for Disease Control provide a lot of data and recommendations for how to handle patient population, as does the World Health Organization and as does the Joint Commission for Healthcare. So we talked quite a bit about the employer. I want to talk about the employee and what they can do. One thing I always recommend is speaking, using your chain of command. The first person, second person would be like your immediate charge person. The next person might be the manager or the director of a particular unit you're working on. Certainly check in with your company that has sent you on the travel assignment. They may have more information, or you may be having difficulty in looking through your contract and your paperwork from that company about the plans, the waivers, the policies and procedures for the facility where you are currently. You may be getting confused. Maybe you traveled prior and it went a certain way, and when you went looking for the information where you're at, you're not able to find it or identify it. So utilize your company as best you can for information, or they maybe can direct you. And if you have any symptoms at all, you need to know what test they're looking for. They're looking for the antigen test or a different test, and is it a fast test or is it going to take several days? And what is the expectation of the employer if you should, God forbid, get the become COVID positive? All right. I think pretty much in most states it's a 10-day. It's a 10-day isolation. So that's pretty difficult for a traveler, because if you're planning on being away from home for 90 days and you've had to cease work for 10 days, what happens to your pay? So do you extend 10 days, and what happens to your plan prior to traveling? What were you planning on doing at the end of your contract? Did you have family obligations? Do you have to do something at your permanent home if you have a permanent home? So there's a lot to consider, and I thought it really warranted talking about because of where we are today, dealing with COVID. Okay. So yeah, the employer does have a lot of responsibility, including they have to have strategies for a crisis in employee shortage. And what can I tell my nurses who are working with face masks and shields and discomforts? Yes. So, well, just be aware there are going to be work restrictions that weren't in place a couple of years ago. Be aware of certain waivers for working with the potential of COVID affecting you and you becoming infected. So the CDC has a lot of recommendations, as does some of the other governing boards like the Joint Commission. Let's see. Yeah, we have problems to mitigate today, tomorrow, the next day. Let's see. Yeah, there are some, for example, I mentioned where my mom has been living for, it'll be 3 years in April. That went fast. She's in an assisted living, and she actually needs minimal assist, but sort of nice now that somebody prepares the meals and cleans her room and her clothing and so forth, so she can not be overly concerned with those activities and have some slack that she hasn't had for the previous 80-something years of her life. She had a stroke about 10 years ago. It'll be 10 years in November. And so it's nice that she doesn't have to be concerned or taxed or overexerted with those things. So that's assisted living for her is terrific in that respect. But she likes her independence. She likes socializing, and COVID has been difficult for her in that respect. But and then she is, I guess, suffering at her end from the shortages because the kitchen staff, the cleaning staff, I mean, she is over a team of nurses and LVNs overlook the assisted persons living there because they're elderly and they do have healthcare issues. Even though my mom can do all her personal stuff independently, they're going to be checking in to make sure she's healthy and has good vital signs and isn't losing too much weight or gaining too much weight and so forth. So they have to check in on her, and they have been quite short-staffed. So that's impacted her a little bit in like maybe delays in taking out the trash or changing the linen or whatever. But one of their strategies is they're constantly in a hiring and training mode. That's one of their strategies. And we don't know how successful they are. I know that a lot of industries, and I think healthcare and technology are probably at the high end of being impacted with staffing shortages. So hey, Sandy, I think you're probably talking to me or tuning in from somewhere in the world. I think you're in Europe right now. I saw some pictures that look beautiful. So I want to talk to the travelers in particular about working in a COVID world where there are lots of staffing shortages, and in California it has reached crisis points. In New York, I believe it has reached crisis points, in other states as well. How that affects you and what you can do about it. And of course, my first recommendation is to always talk to someone in charge. Talk to your travel company about what's the best way to approach a situation. So for example, let's say you're on a med-surg unit and the patient-nurse ratio is 5-to-1. Okay, so you have 5 patients that you're responsible for, and they've been consistently giving you 6. And you're just barely managing to take proper care of them. They are, your patients have multiple needs. Med-surg can be pre-surgical, can be post-surgical, can be medical problems, and often it's more than one problem. They may be admitted because they're having a gallbladder attack, but they may also have diabetes. They may have COVID, and you may be working on a COVID unit. What does that mean? That's not usually going to be a med-surg nurse, come to think of it. But so anyway, so your staffing patient to nurse ratio is off. It's not what you expected. It's difficult to manage, and you feel that you need to do something. And the first thing you do is you check in with, hopefully they have a clinical nurse manager that can direct you very specifically. Maybe she's in charge or manages nurses at the particular hospital you're at, or maybe she's not, and you're calling on the weekend and she's covering, he or she, and they'll direct you to who to specifically talk to about at the who is in charge of management, clinical management for the facility you're at. So let's say that you are somewhere in Texas at a facility and you think, you know what, this is the 3rd time since my assignment started 2 weeks ago that I've been assigned 6 patients, and it's borderline crisis. You know, I'm just barely avoiding a crisis. My patient was alert and oriented when I started, and then I got really busy admitting the sixth patient, and then that patient started to have sundowners at 4 in the afternoon, and we almost had a terrible accident when they tried to climb out of the bed and they weren't stable. So you're getting really concerned that managing the 6 patients is putting yourself and your patients at risk. So you call your company on the weekend when you have some time, or a day off when you have some time, and you get a clinical manager that is not very familiar with your facility, but can give you some guidance and can direct your concern to a manager who is familiar with your facility. And they say, that manager will be back, say you call them today, it's a Tuesday, will be back on Friday. And you say, I really can't wait till Friday. Can we do something else? Well, then your manager may give you basic information on how to handle a staffing issue, maybe direct you to go to the director of the unit or the house manager, or may direct you to her manager at your traveling company, who can maybe investigate and get more information for you sooner than waiting 3 days. So maybe you're going to work the next day and you want to know what to do if it happens again. So the patient safety factor is primary, right? So everybody's aware of that, and there should be a plan and a strategy for that. Maybe they can give you ancillary help. Maybe they can give you an extra CNA when you have a concern. Say, I need to admit this patient. It's going to be 30 to 40 minutes. Can somebody go around and look in on my patients, make sure they're stable, see if anybody has pain, if anybody that was stable and lucid is now demonstrating confusion or anything like that. You have an assistant maybe to look in on your patients while you're bogged down, or maybe the charge nurse can double team with you and maybe start the admission while you do a check on your patients. Whatever, something can be done, but nothing can be done if people aren't aware of a problem. So that's one piece. The good news for travelers is that there's a huge need for you. So if you ever had hoped to be traveling to Hawaii, or traveling to Southern California, or traveling to one of your favorite states, it might be, I don't know, might be Arkansas, might be Alabama, I don't know, where you've wanted to go. Maine is a beautiful state, or Vermont, maybe you're ski buff. Oh, the Winter Olympics, right? They are just amazing. So the good news is that there are a myriad of opportunities for travelers right now. There have been for quite some time, but it's even more so now. So that state of opportunity is rising. I think I will probably talk to that in statistics at some point, because I think it's nice to know where the most jobs are, and where the best pay is, and what is to be offered at certain places. Like Northern California, we have Yosemite, and we have beautiful places for hiking, and the Pacific Trail, and beautiful, just beautiful places. Southern California, we have Los Angeles, we have Hollywood, we have Mickey Mouse, we have many wonderful things, and beautiful, beautiful vistas off the coast from Malibu to San Diego, and even in San Diego, it's about a 1 hour ride if you're looking for snow-capped hill or mountain. That was a great attraction when I first moved here and had small children. We could go up to the mountains, ride some sleds for a couple hours, have a cup of cocoa, and be home in time for dinner back in sunny Southern California. So wherever it is you want to travel, more than likely there's an opportunity for you. So that's what I wanted to chat about, that there are strategies during travel that the employer is going to be highly responsible for because of staffing shortages in staff and travelers. So maybe they're going to bring in travelers, but this week they're particularly short, or these 2 weeks they're particularly short staffed. They have to make concessions, and they're obligated to, because patient safety is a factor, because the Center for Disease Control is mandating it, the Joint Commission is keeping an eye on it, and the staff shortages are problematic and must be dealt with. So know that your employers are aware of that, and if you are having a personal issue during your travel assignment, report it. Report it. Talk to your company, talk to your leaders, and use that chain of command. It's important. It's set up for a reason. And hopefully have a great assignment and repeat it, because there is a big surge, a direction where staff people that have been so impacted are leaving the staff life and going into the travel career path. And how wonderful at a time where it's greatly needed. And yeah, and it exists, like I said, in many areas of healthcare, not just in the acute settings, but in the skilled settings, in the assisted living settings. It is hugely, the staffing shortages has hugely affected healthcare and a variety of facilities. So it's what made me think about talking about all these strategies and what you can do to mitigate the problem and what the employer can do. All right, so I'm going to check out here. I'm here every Tuesday between 10 a.m. and 11 a.m. Pacific Standard Time. This is a recording that happens. It used to happen twice a week. Now it's once a week, and all are in archives. You can find us on Facebook and YouTube. We have many sponsors and a variety of businesses that affect travelers, from people that provide financial support, people that provide housing, healthcare companies, doctor's offices, clinics. These are our sponsors, and they're looking for nurses. I'm going to just do a shout out. There's a personal, somebody came to me personally, a friend of my mom's daughter has a friend who has been struck down. He was a social worker for many years. He has MS, and the staffing shortage has affected him. His name is Dane. He lives in San Diego, and his nurse came down with COVID, and he needs help. His MS has advanced where he can't get in and out of bed alone, and his father has retired and doesn't live that close. So poor Dane is in a bind. He lives alone, and he needs nursing assistance. So if there are any LVNs or highly skilled CNAs or CHHAs, check in with the nurse channel, because we will direct you to this lovely fellow that needs healthcare. So many people that I know are suffering from the shortage as well, on the home health end, on the respite care end, and in all the other facilities we mentioned. So yeah, I just thought I'd do a shout out. We did do a couple of blasts to LVNs, but now I'm thinking maybe a really skilled CNA could be helpful. He's scheduled and covered for many, many hours a week and a month. So if that's something you're skilled at or interested in, give us a holler at the Travel Nurse Channel. You can get us at www.travelnursechannel.com. You can call our 800 number, 800-737-6518. You can email me, Rita, at thetravelnursechannel.com. I think I'll leave out the. Rita at travelnursechannel.com. No, the. That's not part of our logo. It just sounds better. We are the Travel Nurse Channel. Anyway, I'm going to sign off with my fun little commercial. I'll be back next Tuesday. If you need me sooner, go ahead and give a call or email. I'll say it again, hopefully correct. Rita, R-I-T-A, at travelnursechannel.com. Hi, Sandy. Bye, Sandy. I don't know if you're still there. So fun to hear from you. And I'll see you soon. Thanks so much.
Travel nursing can bring you to places you've never been before. Tell us your story.